Hello and welcome everyone. Today we'll be talking about hepatitis and the classification of hepatitis. जब हम बात करते हैं hepatitis की, it is very simple. Hepa means liver, itis means inflammation. So basically, hepatitis means inflammation of the liver. जब because of various reasons liver जो है वो inflamed हो जाता है, उस condition को हम कहते हैं hepatitis. So what is the classification? This is the classification of hepatitis. तो hepatitis को हम broadly 4-5 parts में divide करते हैं, out of which one is infectious hepatitis, then we have toxic hepatitis, then we have autoimmune hepatitis, radiation hepatitis, and non-alcoholic steatohepatitis. We'll be talking about them one by one. First of all, let's talk about the infectious hepatitis. As the name is saying, अगर किसी इन्फेक्शियस ऑर्गेनिज्म की वजह से लिवर इन्फ्लेम हो रहा है तो हम उसे कहेंगे इन्फेक्शियस हेपेटाइटिस. Broadly, we can classify the infectious hepatitis into three main classification, that is viral hepatitis, bacterial hepatitis and parasitic hepatitis. So basically, अगर जो inflammation है liver की वो virus की वजह से होती है, we call it as viral hepatitis. If the bacteria are causing the hepatitis or inflammation, it is known as bacterial hepatitis. And if the inflammation is caused by parasites, we call it as parasitic hepatitis. So the most common, most important type of hepatitis is viral hepatitis. You might have heard about it. Viruses are like they can cause the inflammation of liver. So basically हमारे पास दो तरह के वायरस होते हैं. One we call it as hepatotropic virus and the next one is non-hepatotropic virus. The नाम से बता रहा है hepatotropic means they have special attraction or affinity towards the liver. ऐसे वायरस जो बॉडी में जाके लिवर को ही अटैक करेंगे. They are your hepatotropic viruses and then you have non-hepatotropic viruses who do not like they are not primarily targeting the liver. वो basically primary जो है वो liver को target करने के लिए नहीं है, but yes they might lead to the liver or they might lead to the hepatitis. So जब हम बात करते हैं hepatotropic viruses की, broadly we can classify those viruses into two main category. One is enterically transmitted and one is transmitted through bloodborne. Enterically transmitted means वो fecal-oral route से contaminated water से the person might be getting the infection, and there are two examples, two viruses which are causing the viral hepatitis with enterically transmitted route. They are hepatitis A and hepatitis E. तो बेसिकली आपको याद रखना है कि हमारे पास हेपेटाइटिस A और E जो है वो fecal-oral route से transmit होते हैं. They comes under enterically transmitted hepatitis. Next type of hepatotropic virus is blood-borne transmitted, like जो parenterally transmit होते हैं, blood या body fluid से transmit होते हैं. Examples are hepatitis B, hepatitis C and hepatitis D. So basically जब हम बात करते हैं viral hepatitis की, which is caused by hepatotropic viruses, we can classify it as 5 viruses: hepatitis A, B, C, D and E, out of which hepatitis A and E are enterically transmitted and hepatitis B, C and D are transmitted through bloodborne. Next type of viral hepatitis, which is uncommon, is known as non-hepatotropic viruses which are causing them. And the examples of those viruses are CMV, cytomegalovirus, your Epstein-Barr virus, and your herpes simplex virus. So basically, these viruses are not targeting the liver primarily, but yes, they can also lead to the inflammation of the liver. So these viruses are non-hepatotropic viruses causing the viral hepatitis. The next type of infectious hepatitis is bacterial hepatitis. So basically, not very common, but very like uncommon or rarely, bacteria can also cause the hepatitis, out of which few names of the bacteria are Leptospira, which can cause bacterial hepatitis. Your this Treponema pallidum can also cause the bacterial hepatitis, and even your Mycobacterium tuberculosis, it can also lead to the bacterial hepatitis. Next type of infectious hepatitis is parasitic hepatitis. अगर parasites की वजह से infection cause कर रहा है liver में, it is known as a parasitic hepatitis. And your Entamoeba histolytica is one of the parasite which can lead to this hepatitis, or your toxoplasma. It can also lead to the parasitic hepatitis. So there, it was the definition of it was the classification of infectious hepatitis. Then you may have the toxic hepatitis. As the name is saying, any toxic material can also cause the inflammation of the liver, out of which we can broadly classify the toxic hepatitis into alcoholic hepatitis, drug-induced hepatitis, and chemical hepatitis. As the name is saying, alcoholic hepatitis means the inflammation of the liver which is caused by the alcohol. Everyone knows that alcohol is not good for the health. Basically, it damages the liver, and if the alcohol, prolonged, consistent use of alcohol, binge drinking, heavy drinking, it can lead to the liver inflammation, which is known as a alcoholic hepatitis. Next type of toxic hepatitis is drug-induced hepatitis. As we know that liver is the organ which metabolizes the drugs. So there are few drugs which may lead to hepatotoxicity and also can cause the hepatitis, out of which there is a number of drugs which can cause the drug-induced hepatitis, out of which the common one are your acetaminophen, then your amiodarone, methotrexate, the anti-tubercular drugs such as isoniazid or rifampicin. These all medications can cause the drug-induced hepatitis. And then the third type of toxic hepatitis is chemical hepatitis. So basically chemical hepatitis chemicals की वजह से जो होता है, कौन से chemicals, जो chemicals herbicides में use होते हैं, या फिर those chemicals which are used during the dry cleaning, those chemicals with which the plastics are made, these all chemicals may cause the hepatitis, toxic hepatitis. Then we have some other types of hepatitis also, like you have autoimmune hepatitis. Autoimmune hepatitis means the body's own immune system has started to work against it, okay, and it is causing the inflammation of the liver. तो अगर ऐसी condition होती है, उस condition को हम बोलते हैं autoimmune hepatitis. Then you can also have the radiation hepatitis. As the name is saying, if there is any irradiation to the liver or the surrounding organs, prolonged use of that, prolonged radiation can also cause the damage to the hepatocytes, may also cause the hepatitis. That type of hepatitis is known as radiation hepatitis. And then you can have the NASH. NASH is common, which is a non-alcoholic steatohepatitis. Nowadays, it is actually becoming a major form of disease or a liver disease. ये कैसे होता है? Because of our lifestyle. You know, we are actually having sedentary lifestyles nowadays, and the exercises are less, the sedentary work is more, and the type of food we are eating, junk food, fried food, food from outside, because of all these things, what is happening, liver के अंदर जो है वो, liver के ऊपर जो है वो, there is the inflammation, and it is also causing the fat accumulation on the liver, causing a fatty liver. It is not because of alcohol, so the name is non-alcoholic steatohepatitis. Steato means fatty. Steatosis is a fatty like deposition. So basically, if the fat is deposited in the liver, in the hepatocytes, what it can cause? It can cause the non-alcoholic steatohepatitis, which is known as NASH. Okay, so this is a broad classification of hepatitis, out of which the common one are viral hepatitis, alcoholic hepatitis. Others are also found, but not as common as compared to your viral as well as the alcoholic hepatitis. So that's it for the class. I'll be giving you 2 questions. You have to write those questions in the comment box, and then in the next class, we'll be talking about that. So basically, you have to name any 3 hepatotropic viruses. Okay, you have to write it down. कौन से 3 hepatotropic viruses हैं? And the next question is, you have to write down any 2 drugs which can cause the drug-induced hepatitis. We talked about them, but you can go back and read some other notes also, because I have told you there is a huge list of drugs which may cause the drug-induced hepatitis. So you have to write just 2 drugs causing the drug-induced hepatitis. That's it for today. Thank you so much.